Welcome. Today is the March 20th meeting of the Oregon Criminal Justice Commission. My name is Paul Solomon. I'm the chair, and we are going to start today's meeting with a roll call of commissioners. Carol?
Chair Solomon,
Present.
Commissioner Beach,
Present.
Vice Chair Bovet,
Present.
Commissioner Freeman,
I am here online today.
Commissioner McPherson,
Present.
Commissioner Norton, Senator Przonski, and Representative Lewis.
All right. Do we have anybody signed up for public comment?
I did not get any public comment this time.
Great. Well, our first item on the agenda is the Restorative Justice Provisional Grants Award decisions for 23-25, and I believe Rima is going to present.
Yes, good afternoon, Chair Solomon, commissioners. For the record, my name is Rima Atung, and I'm going to hopefully figure out how to use this clicker. Oh, that's the pointer. Carol is loading the presentation for us, and I'm actually going to be talking to you about the next 3 agenda items. So you'll be seeing a lot of me this afternoon. Here we go. Looks like it's almost up. So yes, as you mentioned, the first item is the 2023-25 Restorative Justice Grant Program. And what we're talking about is the approval of remaining funds for provisional awards. So can you click forward? Yeah, thank you. So if you may recall, back in December, folks made a decision to award 14 on the smaller side awards through the Restorative Justice Grant for the last biennium, of which some were for planning grants, and out of those planning grants, 4 were granted provisionally for Bridge Pajoma, Latino Network, Medicine World Recovery Services, and Transformative Justice Community, as the Grant Advisory Committee had some questions about the scope of the planned projects that those applicants wanted to work on, really fitting and aligning with the scope of our Restorative Justice Grant Program. So those 4 agencies were awarded provisional awards, and what that meant was they had an initial project period from January 1st of this year to March 31st, so we're coming up on the end of that project period, and they received an initial disbursement of half of what they had requested for their full 6-month project. All the planning grants were for 6 months. When you folks did that initial approval of those provisional awards, it was actually approved that they could be granted their full ask, dependent on them complying with some reporting requirements and showing us that they had made those adjustments that the Grant Advisory Committee was concerned about. So they each had to just make sure, in writing, that they were meeting with the required definition of restorative justice as defined in the statute, and they were also meeting with the definition of planning, as these funds were specifically to plan new restorative justice programs and not to expand other similar programs. So we took that information that they submitted to us at the beginning of March, and we also reviewed their budget requests to make sure that if there were any changes needed to be made to what they were proposing, that they were reflected in the budget. So we can move on to the next one. Thank you. So the RJ Grant Advisory Committee met on March 10th. They reviewed all of that information, and they did approve that second disbursement that would be up to the total amount that you folks already had approved, and that extension for the additional 3 months going to June 30th of this year. So the decision before you today would be to affirm that approval and extend those awards and that second disbursement. Move to the next slide. Any questions or comments so far?
Great. Any questions from
No.
commissioners?
And we did provide copies of those reports to you folks if you were interested in seeing the information that was submitted to us. But as I mentioned, the Grant Advisory Committee reviewed everything, reviewed their initial concerns that they had when they first made the awards and determined that those conditions had been met. So I have some sample language here for a vote if you folks would like to discuss or possibly vote on making those changes and extending those projects and the second disbursement.
Great. Thank you, Rima. Any discussion? Is there a commissioner who'd be willing to make a motion to the effect that's listed here?
Thank you, Chair. This is Vice Chair Bovet. I'll move to authorize a second disbursement and associated project extension for Bridge Pomoja, Latino Network, Medicine Wheel, Recovery Services, and Transformative Justice Community as shown in the Commission-approved Provisional Planning Awards funding table.
Great. Is there a second?
I'll second.
Great. We have a motion made by Vice Chair Bovet, seconded by Commissioner Beach. Carol, would you please call roll?
Chair Solomon,
Yes.
Commissioner Beach,
Yes.
Vice Chair Bovet,
Yes.
Commissioner Freeman,
Yes.
Commissioner McPherson,
Yes.
then it passes.
Great. Thank you. All right, Rima, you're still up. So next we'll move right into the restorative justice grant solicitation for 25-27.
Thank you. So this is for the next biennium of funding that we are anticipating and hopeful for 25 to 27. If you'll click to the next slide, please. So the first ask that I have for you is this agenda item was initially presented as a no action item to just give you folks an opportunity to review the solicitation and provide feedback. We actually would like to request to change it to an agenda item, an action item for you folks to vote on, because we did get some feedback and made some changes to that initial proposal, or excuse me, initial solicitation that we had shared with you from the Grant Advisory Committee to add some more specific questions. So we were hopeful that we could change this to an action item.
Great.
Okay, excellent. So as I mentioned, we did get some revisions from the Grant Advisory Committee. We shared those with you via email at the beginning of this week. And we also have printed copies in case folks wanted to see what changes were made. Basically, our plan is to release the solicitation in April, the beginning of April. We are still, we don't know the total funding available. There was 4 million requested in HB 5005, but we'll have to wait till the end of the legislative session to get that confirmed. But we do want to open, we're doing a 2-part solicitation process. We do want to open that initial part, which would be focused on the program narratives, so we can get the process rolling as early as possible, especially for the RJ grantees, which are primarily community-based organizations. They sometimes really rely on that funding, and we wanted to make sure that there was as small a gap as possible. So starting the solicitation process as early as possible would be great. And then we would do the second half of the solicitation focused on the budget once we get the confirmation of the funding. So that was one notable change from our previous solicitations. The other notable change is just a change in the eligible applicants to be established or implementation programs, and that's just directly from the rules and statutes. Again, our intention is really to kind of, at this point, we have had this grant for a few years, is to kind of open it up and see where all the programs are at. In past partially due to the funding and how it's been cobbled together from when it was first established. We've been mostly focusing on maintaining the existing programs. So we kind of want to open it up and just see the full field of everyone who's out there. So that's why we made that change. We can go ahead and move to the next slide.
I just want to make a comment.
Sure.
here. I think this illustrates kind of the challenge that we have with funding in general, where like with our treatment court programs, while we want to increase participation, unless we get more funding from the legislature, it thins the soup.
Yeah.
And I appreciate what you're doing, but it also limits the growth of the program by doing that. And I think it's one of the things that we continually have to kind of look at, because at a certain point, you know, if we're not able to get more money, it doesn't make sense to expand if we're going to have to reduce funding for programs substantially.
Yeah, and
I also see Commissioner Freeman has his hand up.
Oh, yeah, go ahead, Commissioner Freeman.
Thank you, Chair Solomon. And kind of on those same lines, you know, the funding amount's incredibly important. My question's more around the timing. And of course, as a small county, we deal with this on all kinds of state funding, but, and I know you can't award the money until you know how much to award from the legislature, but with having the gap from the time when you accept applications until you can award the money, there's a, you know, depending on each of these programs we're looking at today, there's a significant gap. And I'm curious, you know, how many existing programs have anticipated that gap, and, you know, what your anticipate new programs, you know, even though the paperwork says, you know, the funding is from July 1st, 2025. Well, if you don't get the money granted until, you know, September or October, you certainly are, if you spend money in those months, you're gambling you're going to get it. And if you don't get it, you might be in a world of hurt, or you're letting programs gap or not starting programs until you get the money. Either way, it's problematic. So I'm just curious what other feedback you get on that.
yeah, absolutely. And I can respond to both of those questions. So to respond to yours first, Commissioner Freeman, we are offering our current grantees a 1-quarter extension, a no-cost extension to the end of September. It doesn't necessarily solve that problem if folks are, you know, planning to run through their entire budget by the end of June. But it does leave a little bit of cushion for those programs that can extend those funds. So if they can't be awarded until September, they'll have a little bit of wiggle room. At this point, you know, I think this was the best solution we could come up with, was just starting the first part of the solicitation process as early as possible, and then making the budget determinations as soon as we get that information on whether or not the budget is confirmed in July. And then kind of to speak to your comment, Chair Solomon, you know, part of the benefits of this 2-part process is that we can see what the whole field is of folks that are competing for these funds. And since we're going to do the programmatic review first, and there's going to be a gap in time for them to submit their final application, we use that time to get questions from the Grant Advisory Committee, and we send those to the applicants so they have a time to respond and to you know, alter their final application to meet any concerns that the Grant Advisory Committee has, and also to adjust based on what budget is there. So they have a little bit of responsiveness in their application. And at that point in time, we can, you know, weave in some of those concerns about, you know, how do we prioritize new versus existing applicants.
Great. And Director Sanchigan is going to expound further on the funding gap.
Yeah, just briefly, and this previews a little bit of what I was going to talk about in my legislative update, but we're keenly aware of the challenges that arise, whether CBOs, counties, cities, when we have these funding gaps, and the challenges, especially with general fund. And so we've begun over time to receive a number of programs like illegal marijuana, deflection, impacts that are classified as other fund, which gives us a lot more flexibility to spend beyond the end of the biennium. And so among a suite of some technical proposals that we're working on with Representative Crop for all of our grant programs. One thing that we're trying to advance this session, though it's not dropped quite yet, is to convert all of our grants to other fund grants. And so that in the future, if we truly are on a cycle of October to October, because of the way the biennium works and the way that our funding comes through to the agency, we can just be upfront and do that. And we could actually close out one year and get to the next one, as opposed to having to use no cost extensions or other approaches. In the time I've been at the commission, the guidance that we get from the combination of our accounting, our legal, LFO, CFO, it's changes so much that it's become more and more frustrating trying to actually get, do this the right way. And especially for small CBOs, that lapse of funding could be the end. That's something that we want to try to address.
Great. Thank you.
So we can move to the next slide. Thank you. So I included, just as a reminder, and we'll just flip through these slides, just the existing grant requirements. I'm not going to read through them all, but just to point out some of these changes that were requested to the solicitation were based on the Grant Advisory Committee wanting to make the eligibility requirements and preferences that are stated in the rules and statute a little more measurable, a little more specific, so they get that information up front. And so what we did is, you can flip to the next one as well, and then to the last slide, sorry. So the next one. What we did is we just tried to, again, weave in some of those specifics into the front end of the application. So it's including things like number and source of referrals, number and type of clients served, staff training hours. And then also into the rubric that staff is going to be using to do our first initial staff review, when we do the review and prep everything for the Grant Advisory Committee to then review and do their prioritization process. So we emailed you a copy of this, and there's printed copies as well. I apologize. The printed copy is like very, very tiny, but it shows us the draft, rubric that we're going to be using to do this scoring, and how these different items relate to those more broad and harder to define, eligibility requirements and preferences. So we'll be using that, and we wanted to, make this publicly available so that folks know when they're applying exactly what we're going to be looking at. And so, GAC members also have the same information. So we're going to post this on our website so folks can see how they need to respond to these questions, and also, of course, reference them in any webinars we do on the solicitation, so that it's very clear what kinds of information we're looking for to get at these requirements that are kind of more vague. So that's the basis of what those changes were. It wasn't anything substantively different than what's in those eligibility rules and requirements. It's just more specific.
Great. Thank you. Any input from commissioners? Yep. Commissioner McPherson.
Not used to this. Yes, it is. Thank you. I just want to take a moment to just indicate that I appreciate Commissioner Freeman and Chair Solomon's comments, as well as Director Sanchagrin. I was not a commissioner at the time that the Restorative Justice Program started or was being funded, but I just want to indicate how much I support it, how important I think it is for our state and our community, and that we need to prioritize restorative justice going forward. If people have not read Daniel Sered's book, Until We Reckon, I highly suggest that they do, as it's a firsthand account on how important and transformative restorative justice is. It's based on a program in New York where they indicate that they don't work with domestic violence survivors or sexual assault victims, but other violent felonies they do. And when they find that the overwhelming majority of victims of crime would prefer restorative justice over the criminal legal system. I've been the victim of several crimes myself in my lifetime, and I know the questions that you want answered is why me, and how can you prevent this from going forward? That's what restorative justice does. Been a public defender 27 years, criminal legal system never answers those questions for people. So it's just critically important, and I hope that we prioritize it as a state going forward. Thank you.
Thank you. So
We do have some sample motion language just to vote to incorporate those changes that were included in that latest draft of the solicitation and the scoring rubric.
Great. Any further discussion? All right, is there someone who'd be willing to make a motion to approve the second version of the RJ solicitation that was sent to the commission on March 17th to include the RJ Grant Advisory Committee recommended changes to the Criminal Justice Commission staff scoring rubric?
This is Rob Bofett, Vice Chair. I'll make that motion since you've already read it.
Commissioner McPherson, I'll second the motion.
Great. Motion made by Vice Chair Bovet, seconded by Commissioner McPherson. Carol, would you please call roll?
Yes, Chair Solomon,
Yes.
Commissioner Beach,
Yes.
Vice Chair Bovet,
Yes.
Commissioner Freeman,
Yes.
Commissioner McPherson.
Yes.
So then it passes.
Great. Next up is the illegal marijuana enforcement grant solicitation for the 25-27 biennium.
Thank you. And we can move on to the first slide in this section. Thank you very much, Carol. So similarly, we're hoping to do a two-part solicitation for the 2025-27 biennium marijuana market enforcement grant program. Our estimated release date is in the beginning of May. Currently, we have about 7.6 million with our that is allocated to this biennium, although we are still waiting for a final amount to be officially determined at the end of this legislative session. So we want to do the same thing to try and speed along the grant process. We do have a little bit more wiggle room here because our current contracts end in December or at December 31st of this year. But we don't want to run up into that deadline as much as possible. So we're trying to get it started earlier with this two-part solicitation process. For this grant, eligible applicants are units of local government and community-based organizations. We didn't make any notable changes from our previous biennium solicitation. And you folks do have the option to, or discretion to set additional criteria. So that's why it's in front of you today.
Great. Any thoughts from commissioners about additional criteria? What's that? Oh, Commissioner Freeman, go ahead.
Thank you. And this is one's pretty near and dear to me. We have a lot of this problem in my area of the world. I'm curious, as you go through your list, is there any, where it says tracking of outcomes, is there any definition of what that means? I mean, is it the number of plants? Is it the number of sites? Is it the number of people we help that are in human trafficking situations? I'm just kind of curious of what metric, the outcome portion of that will be, and knowing firsthand how quickly the people that do this illegal activity change their business model. They literally do it different every single year, and they're very adaptive to whatever techniques that the enforcement folks are doing. So maybe just a little bit more of an understanding of the, measurement of outcomes or metrics they're trying to meet, or things like that, I would appreciate.
Could I actually
Yeah,
address
absolutely.
pieces of that, just for everybody's information? I'm, as with some of our other programs, I'm pretty heavily involved with this program, which was conceived in 2018 and then expanded pretty dramatically when what the commissioner just referred to happened really during COVID, which is a large influx of cartel grows, particularly in Southwest Oregon, impacting his county in a very dramatic way, but also other counties up and down the Willamette Valley. So this program here as described, will essentially run out of money in the middle of the biennium if it's not refunded, re-upped at its enhanced level. So as part of House Bill 5005, we have introduced the -1 amendments, which would provide an additional infusion of $11 million in addition to the carryover referred to, which is in addition to the $6 million base allocation to continue at roughly current service level over the next biennium to continue to address the problems created by these cartel grows, which are not only the crime that is associated with them, but lots of victims of labor trafficking, unfortunately. So that's why this has two large buckets, one related to enforcement, one related to victim services to victims of labor trafficking. In terms of tracking outcome, I'll also let you know, CJC staff put together really an excellent annual report of the program. Was just finalized in January. It's posted on the CJC website, but it's very difficult to find, at least for me. So I repost. Yes, I reposted it. If you go to House Bill 5005 and go to the testimony, we were supposed to give all this on the snow day. It got carried over to April 8th, I think, 3rd. And so in the testimony, you'll find the report posted, which addresses all of the questions that the commissioner asked in terms of the tracking outcomes. We track everything he listed and then some. I think it's really an excellent report that I would encourage anyone to look at because I think it proves not only the value, but the efficacy of this IMMEG. And it's important. And also posted there are, it's a little hard to find, the -1 amendments that would add to the base CJC budget bill so we can continue this program at its enhanced level. I'm not suggesting any additional tracking outcomes because I think our report is pretty darn thorough, and I think the program has proved its efficacy. We intend to have a number of sheriffs testify at the hearing when it comes up here in a couple of weeks, as well as the victims organization, victim services organizations will be there to testify as to the efficacy as well. Unfortunately, this program didn't get put into the governor's recommended base budget. Primarily, I think, because it's still technically a temporary program. And so we have to make the case each biennium, and that's fine. I think we can make it. And I think the report made it really well for us. So sorry, I went off on a little bit of a soapbox there, but it looks like Commissioner Freeman has another comment and question as well.
Yes. And I don't know, Rima, if you wanted to provide any additional comments about the tracking outcomes in response to Commissioner Freeman's first question, then we'll go to him
As
right after
Commissioner,
that.
Vice Chair Bovet mentioned, we do track a lot of data for this program. I don't think we would want to add any data points. We're already receiving, so many different pieces of data about the incidents, about the human trafficking victims that we publish annually in the report. I think a challenge for this program is that it's relatively new still, and so there are no standard definitions for what success looks like, and that's something we've been building every year, and hopefully the report reflects that. But we definitely do collect information on all of those points that were mentioned.
Great, thank you. Commissioner Freeman?
Thank you, Chair, and thank you, Commissioner Bovet. I have seen the report. I know what's tracked. I didn't make my question clear. My question was, to the extent that that's happening, how does that affect the grant approval? And I'll just, as an example, again, I'll pick on Douglas County. Over half of the eradicated plants last year in the state of Oregon, that at least in the areas that take this funding, were done in Douglas County. We are being sort of, maybe over predicting, but we're thinking maybe we're getting to 20% of the grows. So my question is, what of those outcomes we are tracking, and you're right, there is a whole list of outcomes. How are the priorities set for the funding based upon the outcomes or priorities?
So to be determined. I think is the answer to that now. I mean, we have the legislative and commission priorities. We have the data that we can use as part of that initial staff analysis to kind of set the stage for the grant review committee and the commission to make those decisions. But no additional priorities have been set beyond these currently. So if you folks have feedback on that, we'd be happy to listen to it today.
Great. Director Sanderson?
And yeah, just a little bit more information on how we've run things in the past. So when the grant was first deployed, we only had 4 grantees, and then for a couple of years we had 3 grantees, and for the most part, the need was commensurate with the ask, maybe not entirely. When we did get additional funding during 2020, that was one of the first times that we received. I believe we had around $20 million. Ask was around 30. And so what we did at that point was we took the legislative priorities and the commission priorities and we assigned scores to them. And we tried to come up with a rubric that put counties into different tiers for funding, so that if you were in the highest tier, then you would get the largest proportion of your ask. If you were in a lower tier, you'd get a lower proportion. And I point that out not to say that that was the best approach or the only approach, but I think it does go to say that when we're looking at these legislative priorities and commission priorities, this would be the opportunity if Commissioner Freeman wanted to request that we, through our process, take into account previous performance in some fashion, then that could be something that staff would consider when it puts its recommendations before you in the future. And so it's mainly to make that point, not necessarily to dwell on what we've done thus far.
Thank you. Commissioner Freeman?
Well, thank you. And I'm not making any suggestions. I just, as with everything we do, we have a limited amount of funding to provide the best benefit. I just want to make sure we're thinking about how we get the most return on those dollars. And, even though, that amazing, horrible amount of illegal marijuana is being grown in my county, we're an opt-out county. You're not even supposed to be growing recreation marijuana here, but that marijuana isn't being consumed here, or at least not all of it. The vast majority of that is leaving the county, and a significant amount is leaving the state. So everybody's affected by it, but, and that's true for every county. I just want to make sure we're not sort of thinking about, well, how do we be fair and give all the counties, a little bit, instead of focusing on where we can get the most return on how we spend the money. So again, I'm not suggesting a change, but just wanted everybody to sort of think about that. And you're right, in Southern Oregon, it's bad.
Thank you. And I just want to chime in here. I've been fairly vocal about this in the past around other issues, and it's the idea of paying for success and looking at metrics that determine that are really in line with the outcomes that we are striving to achieve, whether that's prison reduction, illegal marijuana eradication, that we are focusing our resources on those programs that are having the greatest impact. And, oftentimes we are constrained by, legislative requirements or formulas, but to the extent that we are able to factor in those type of considerations, I think it's important that we should be doing it.
Thank you for that feedback. And we can absolutely, look at the data that we do have related to, the outcomes that we are measuring and try and highlight some of that information, at least for existing grantees, in the staff analysis when we present it to the grant review committee and to you folks. I do want to point out also that similar to RJ, with this 2-part process, we can give you all that information along with the narrative in the first part of the process. And then that also gives you the opportunity to ask questions about any numbers that you have questions about, or, gives the opportunity for the applicant to provide additional information outside of those numbers, just to keep the process fair. So I think that's the benefit just to bring to your attention.
Any other input from commissioners? All right. This is was an action item, correct?
This was not.
Okay, this was informational. Okay, great. Super. Well, thank you, Rima, for your
Thank you very
reports. Next up, we're going to hear from Dr. Carlson about the Gun Violence Review Committee and a request that they are putting forward. Welcome.
Hello, thank you. Thanks for having us. Carol. Okay, so I'm Kathleen Carlson. I recognize some of you from last year. Nicole Sarah is my senior project director who is newly joining us this year. Thank you for having us and thank you for your past support for the Gun Violence Review Commission of Multnomah County. We're really excited to share progress and some updates with you. So I think if I could really highlight, the Gun Violence Review Commission and our focus as public health professionals is to push prevention as far upstream as we can. And hopefully that's a thread that you'll see through some of our activities and the actions that are going on now as a result of the commission work. So back to the team, sorry. You might remember some of the team members from last year. It's all the same team. Susan DeFrancesco on the bottom, she is phasing out her work with us after 40 years in public health and handing reins over to our very capable Nicole here. So that's why you're not seeing her here today. Okay, next slide. So this is just a reminder that fatality review commissions are sometimes called violence reduction councils. These are a long-time public health strategy to pull together experts from across multiple disciplines and put them in a room with people with lived experience and with each other and conduct a series of deep case reviews of individuals lost to tragedies. In our case, public health tragedies. So one of the most common review commission format is child fatality review, which is probably the most prevalent across the country. We also have overdose fatality reviews, domestic violence reviews. I think elder abuse review is another one here in Washington County. And these are common in public health practice because they are effective. Second bullet there shares that the Johns Hopkins University Center for Gun Violence Solutions identifies these types of commissions as one of 5 programs that are evidence-based for reducing violence in communities. And then the third bullet there is some peer-reviewed evidence on a commission in Milwaukee called the Milwaukee Homicide Review Commission that after 7 years of implementation and work, there was a 52% decrease in the counts of violence in the jurisdictions in which that commission was working and implementing interventions. So that might give you a sense that these are heftier strategies that these review commissions identify and work to implement, but they can be really cost benefit in terms of the magnitude of reduction that can be realized through this kind of work. Next slide, please. So the purpose of our commission, it's focused on Multnomah County now to start, but our focus is to pull together this comprehensive, multidisciplinary, interagency team across the county to review gun violence incidents, to better understand the circumstances that lead to those incidents, so patterns of circumstances, and then to use those patterns to take action to reduce the occurrence of subsequent events like this. So it could be life course patterns that we see across multiple gun violence cases. It could be gaps in social systems that occurred across multiple cases. It could be living environments, like certain neighborhood structures that our committee members recognize and say that's what's contributing to the violence in this area. So a whole broad perspective is taken. The mission of our group in particular is to use this innovative and interagency community-based collaboration to ultimately reach our vision of creating a community where everyone can live free from gun violence. Next slide. This is just a high-level overview of how we've structured the the commission here, and this reflects how they're structured elsewhere across the country. In particular, Milwaukee, which had that 52% reduction, they're our colleagues and have been mentoring us on the startup and implementation of the commission here in Multnomah County. So we get a lot of help from them. This is, it shows you that there's two teams that are like the heart and soul of this Gun Violence Review Commission. One team is the review team. This is who's doing the in-depth review of gun violence cases. And then the implementation team is who takes the recommendations that the review team forms after their review and works to pull the levers, connect with the people, do all the pieces that need to be done to make the change to fill the gaps that the review team is identifying. We have purposely designed some overlap between these two teams to facilitate communication between them. And both of these teams include professional experts as well as people with lived experience, so that the lived experience can inform the opinions and the recommendations made, and there's a two-way street between those two. And then we're kind of down here on the bottom, we see ourselves as what would be called a backbone organization, where we're administering this, we're supporting it, we're organizing meetings, we're keeping nudging, keeping the meetings and going, and the long-term vision of this in mind. So last year when we came here, we had kind of this linear progression of where we had been and where we were. And at that point, we were at that middle square there. This was everything from developing the relationships of our commission members. And we have about 50 people who are involved in the commission. So that was a lot of relationship building and getting their buy-in. Working with the Multnomah County DA's office to figure out how best to get closed cases of homicide or attempted homicide, worked through those issues, continue to work with the DA's office with the new DA as well to get cases, holding meetings with the review team, developing recommendations with the review team, finalizing those and handing them over to the implementation team. Next slide. And as we talked about, like, how could we continue this linear format to show where we are now? There really was no way, next click, because all of these pieces now we found are going on simultaneously. So it's an iterative process, but it's also like we have implementation team work groups who continue to meet to work on the strategies to implement the recommendations that came out last year from the review team. And that'll be an ongoing process. Some of these recommendations that they're working on to implement, maybe they're going to be short-term, but some of them can be mid-term or long-term, like heftier changes. At the same time, our review team continues to review cases and develop recommendations to add to the list that then the implementation team will look at and pick up and try to adopt in Multnomah County. Next slide, please. Okay, just outcomes by numbers. So the review team itself has 34 individuals involved. They represent 25 organizations across the county. And last year in 2024, we had 11 meetings with them. Next slide. They reviewed 13 cases. At first, we had selected cases from zip codes in the county that had the highest rates of gun violence. And that was so that we could hone in on what environmental or social factors might be going on specifically in those neighborhoods. After that, the group then decided that they wanted to focus on youth under age 25 because we were seeing a lot of youth involved in those cases that we had already reviewed. So we went from by zip code for selecting cases to youth, and now the group has opted to focus on homeless and unhoused individuals involved in gun violence cases. So the number of recommendations that came out of the first series of in-depth reviews was 36. Next slide. And we have those posted on our website at the Gun Violence Prevention Research Center. We also have,
Dr. Carlson, can you give us some examples of the types of recommendations that are being made?
We'll actually get to those,
Okay.
But it really varies. It can vary from addressing closing hours and lighting situations at a corner shop on this particular intersection, to identifying kids at risk in schools and ensuring that they have wraparound services around them, to what other?
I'll talk more about it.
Yeah,
I'll get to it,
it's
yeah.
really varied. Criminal Justice Commission reform. So it's we try to organize it by themes. But if you saw our list of 36, it'll be organized by themes, but there's quite a breadth of recommendations in there. And that's a result of the broad expertise that we have in those review team members.
Something I would say is that what we've been learning from our colleagues in Milwaukee, that there are some, as Kathleen mentioned, short-term recommendations and long-term recommendations, but there are also some small recommendations and very large recommendations. So what we're really working on right now is figuring out that some recommendations that actually doing research into a particular issue can be a recommendation in itself. It's not like, let's solve the housing problem in Multnomah County. Okay, that also can lead to reduced rates of gun violence, but that they can kind of run the gamut, So
yeah, thanks. So we do ongoing formative and process evaluation, and this was just some nuggets from evaluation we did last year that we felt really proud of. Our review team reported to us, 2/3 of them said that through the Gun Violence Review Commission, they had developed stronger partnerships with their colleagues at these different agencies and organizations that they, in a lot of cases, didn't previously have relationships with. So the network of communication across Multnomah County is strengthening in part because of their work on the commission. And half of them said that they had developed new partnerships, which we've seen take place at the meetings as well. Okay, next slide. Outcomes in terms of the implementation team, we have 24 individuals involved. Now, these are elected people. It's the sheriff, it's our public health officials, folks with lived experience who are there all interacting and talking about what levers they have available to them to pull to actually make these changes that the review team has recommended. They represent 20 organizations. Next slide, please. They met virtually and then in person last year. We worked with a professional facilitator in that in-person meeting to work them through the 36 recommendations, to organize those recommendations into a group where they felt that they had the expertise and the political power and alignment to make some change in those areas. And then from November to now, 4 work groups have been working with a cluster of recommendations, which Nicole will talk about. Next slide. And this is just a photo of some of the folks at that implementation team meeting. You might recognize it, the local people might recognize some of the faces here. It was a great group. Okay, next slide. Okay, I'll hand over to Nicole.
So I'll get into a few of the recommendations that were selected for implementation. So, and just to give you a sense of like how this process went at the meeting, like Kathleen said, we had a professional facilitator who really clipped it along and made sure we came out of that meeting with recommendations that we are going to implement. We had a very specific goal. And we had champions step up. So we thought, okay, how can we, what's the best way to get people to sign on? I mean, this is all volunteer work, right? So, and so we had asked for champions. Who wants to work? We had first we had an impact and effort matrix. So we said, okay, how much impact will this recommendation have? And how much effort will this take? And from there, a couple, 5 or 6 recommendations surfaced. And then from there, we asked for champions. We're like, who wants to step up and take action on this? So we figured the people who had the most motivation would be the most likely to implement. So from this first work group, we have they're working on 2 recommendations. The first is to require the OLCC, Oregon Liquor and Cannabis Commission, to use its regulatory authority to implement existing regulations and work with local law enforcement to investigate retailers where gun violence occurs. And then to require the OLCC to use its licensing authority to decrease alcohol and cannabis outlet density in areas with high rates of gun violence. And this recommendation came up because in over half of the cases we reviewed, alcohol was involved and actually other substances. So this surfaced, and this was a handful of review team members came up with this idea and had prior experience with OLCC as well. So we're actually quite happy with the progress on this recommendation. Our team, members of our team and members of the Oregon Health Authority, Ali Hamadi, who's a epidemiologist at the Oregon Health Authority, are working to conduct a data analysis on gun violence incidents contrasted with alcohol outlet density. So the first step in the public health process is defining the problem. We don't even know exactly where all these alcohol outlets are and how dense they are in Multnomah County. And so we want to understand the problem, and especially with an epidemiologist on this work group, right? And so then in the last month or so, that work group met with an OLCC representative. They came and talked to the work group, talked about what's happening at the OLCC, what the progress on this recommendation is so far. This is actually, in terms of making, we all know, working in policy, that there's a political moment where you can make change. This is the political moment for this change. There is a public health policy analyst who came to the meeting who's quite excited and working with us. There were changes in OLCCs in the way they're thinking about public health and incorporating it into their work. So this is actually, in terms of recommendations that we see the most promise, this is the one.
They shared data on all OLCC licensed operations across the state, which I was looking at yesterday.
Yeah.
So sharing data to make this happen.
You can go to the next one. I know we're probably going over time here. I want to make sure you have time for questions. So I'm gonna, I'll go in a little less depth on these next two or these next three. But the second recommendation that this work group is working on is adding local law enforcement resources to the Bureau of Alcohol, Tobacco, Firearms, and Explosive with straw purchase investigations. Sheriff Morrissey is working on this recommendation with one of her colleagues, Captain Hemsworth. We also have a representative from Central City Concern, Richard Ott, who's on the executive board there, and then Jennifer Hardnett, who has a consulting business, Longevity, who has lived experience of gun violence. But this work group met with the ATF Assistant Special Agent in charge of the Seattle Field Division and the executive manager of the Oregon Field Offices, who shared how a partnership can be built. A lot of this, actually, there is quite a bit of partnership already. So this work group is trying to figure out what's the next steps are. Also, just to be realistic, ATF is a federal agency, and we all know that federal agencies are getting cut right now. So we're kind of thinking about that as well. Third recommendation is to offer opportunities that was selected for implementation, I should say. Is to offer opportunities for home ownership to tenants of low-income housing complexes with high rates of gun violence. And staff, we have Charlene McGee from the Multnomah County Health Department, who really invested resources into this recommendation. She has staff who she said, okay, my evaluator is going to conduct a literature review on whether whether homeownership is a protective factor for exposure to or involvement in gun violence incidents. So that happened. We're reviewing the results of that literature review and charting next steps right now. And then the last recommendation is to identify a network of community services that can be tapped into by schools and care teams. This group has 4 individuals who work directly with communities directly impacted by gun violence. Jimena Ospina from Latino Network, Rico Williams from the Multnomah County Education Service District, Brian Detman from Youth Development Oregon, he's in the governor's office. He works a little less. He calls himself a government bureaucrat. Those are his words. And then Lionel Irving from Love is Stronger. But they have chosen, rather than identifying a population in the schools that's high risk, so to speak, they've decided they wanted to work with Ceasefire which is Portland's Focused Deterrence Program. Who already has identified a group that's at high risk of gun violence. So they are going to meet with that. It's taken a bit to get everyone in the same room. They're going to meet with Ceasefire. We are going to meet with Ceasefire in a couple months. But just in terms of next steps, our roadmap in 2025. So really, I just want to emphasize our long-term goal is to get this enshrined in Oregon statutes. This is similar to other fatality review commissions, the Domestic Violence Fatality Review Commission, are all all enshrined in Oregon statute. That's our long-term goal, is to have a permanent funding source. Kathleen sits on the Oregon Task Force on community safety and firearm suicide prevention. So we're really trying to leverage that position to get this to happen. That's really that's really where we feel like this should go in terms of having a comprehensive approach to violence prevention in Multnomah County.
Well, and this is Multnomah County, but even thinking of the Oregon Task Force's recommendations to other jurisdictions in the state of Oregon, where maybe the Multnomah County experience can help inform or serve as kind of a hub and spoke model to help other violence impacted areas in the state.
Mm-hmm.
But just to recommend, the task force is working on recommendations, and one would be a firearm suicide task force, and one would be a firearm homicide task force that we're working on developing.
So that's our goal. In terms of the next year, our implementation team will keep working on these recommendations. Our review team, as Kathleen said, voted to review cases on individuals who are houseless. So we've been looking at those cases this year so far. And then we've had, this is another point I really want to emphasize, is that I have program implementation, public health program implementation experience, but also program evaluation experience. And I'm quite committed to getting feedback from both review and implementation teams to improve the program. So, and then also continuing to work with our Milwaukee Homicide Review Commission colleagues. And just real briefly, from January through August, we'll review cases. We'll have an implementation team meeting to update them on progress on the work groups. We will have a work group meeting in September and October, not the implementation team work group. We're going to form a review team work group, and who will finalize recommendations. And then the full review team will finalize recommendations at the end of this year. And then in January, the implementation team will select new recommendations to prioritize and implement. So we decided to do this to kick off the new year next year with implementing more recommendations. We did it right before the holidays this year. It worked. I think it'll work better if we started it in the new year. And then, as I said, we really have this commitment to improving. We continue to meet with our colleagues in Milwaukee. We have did 2 surveys this year, interviews for review team members, continue to solicit informal feedback. The Johns Hopkins Center for Gun Violence Solution has a violence reduction council toolkit that we've read and continue to draw lessons from. And then, one last point, just to drive this one more point home, is that involving individuals with lived experience of gun violence is really important to make recommendations responsive. And we're going to continue. I mean, this is an ongoing process. It's not like we hit a home run last year. We're going to continue. We need to continue to do this more and more, because and I talked with one of our review team members who does outreach work, and just staying in touch with what it's really like to have been shot, or to have known someone who's been shot or killed is quite important. So to having that kind of the basis of our, just kind of really at the core of what we're doing. So I think with that, yeah, go ahead.
Do a time check. We probably got about 5 more minutes.
Yeah, that's it. We're all set. Yep.
Great. So the request that you're making of the commission?
We are requesting further support from the commission, and Director Sanchagrin and I had talked about requesting 2 years of support. I did not come prepared with a physically written number, but we got a call on the way here that maybe we should have had a number for you to vote on today.
Yeah.
I do have a number in mind, and maybe that has made its way to your no. Okay. So number that I have in mind to support the staff and efforts that we have found that this needs is $350 per year. And this last year we had $269 funded. Part of that goes to overhead to our institution so that it doesn't totally cover staff, but I've needed to draw in staff from other projects to help make this project continue. And so we will work with what we can get because we are fully committed to this, and swimming upstream in a lot of challenging stuff right now as academic public health researchers, but we're really committed to this project, and we'll make it work.
Great. And I see we have a question from Commissioner Freeman, and then I have a comment.
I do.
And so does Vice Chair Bovet. Go ahead, Commissioner Freeman.
Well, thank you very much, Chair Solomon, and thank you for the presentation. My question is really around scope and what this program's all about. So when the inception of this, when we were talking about it, was really around gathering evidence and information and having more data and understanding what the gun violence problems were and what created gun violence and ways to address that. You brought up an organization, and I'm curious how you're going to interact with an organization like Ceasefire that is adamant about pushing gun control laws through the legislature, which is not what this committee was supposed to be about, in a way that you're working with them so you're not using taxpayer funding to do lobbying efforts to push gun control bills.
That's a good question. I appreciate that. So we're working with Ceasefire in the capacity of how to implement that recommendation for how to get community resources, schools access to community resources. So they currently work with schools. So we're going to work with them to work with schools. That's the idea. This isn't an advocacy effort. It's actually, I feel it's a program implementation effort in that. Do you have a follow-up question though? I imagine you would.
I do. And again, I don't want to argue with you, but I just want to make you aware where you might, in the communities where you're working, may see Ceasefire as an advocacy or a communication or an education group. In areas other in the state, that is not how Ceasefire Oregon is seen, and they would not be. I can just imagine, having a child in the school where Ceasefire Oregon was talking to them down here where I live, would not only cause the school problem, but it would be not effective at all in an educational setting. So just be aware there's different opinions in different areas of the state.
I just realized that we're talking about two different Ceasefires. One is the Ceasefire Oregon, which is wholly an advocacy group. The other is a program out of the Portland Office of Violence Prevention called Ceasefire. It's based on the Cure Violence model, which back in the day when that model was developed, they called it Ceasefire. Now it's called Cure Violence, but the city of Portland, for some reason, went back to its original title of Ceasefire. So that's the source of the confusion. We are not working with the broader Oregon Ceasefire advocacy group.
Great. Mr. Bovet?
Yeah, this is, as probably will mention later, my last in-person meeting of the CJC after working with the CJC for a few decades and being on the commission for the last 10 years. I remember when we first started a little bit of seed money here, which I was strongly supportive, and I still strongly support your work. But I think maybe we're down the road far enough where I think we need a formal written proposal. I think we need some level of deliverables and accountability built into the system.
Mhm.
And my real question is, I guess, of Ken, where's the source? I think I know where's the source of funding? And are we seeing any potential implications on that funding from the latest, let's just say, federal actions? So I'm not willing to vote on a motion to just give some blanket authority. I think we need something here in writing for deliverables, for accountability, if nothing else, to protect your program.
Mhm.
But I guess I throw it at Ken. Where are we gonna get the money from, and what do you think? You're gonna have to get your crystal ball. What are you seeing with the burn money?
Yeah.
Well,
Mhm.
you answered the first part of your question. Yes, we would be looking at Burn Jag as a source for these funds. And what I would say right now is that in spite of everything that we hear in the media, or there are challenges that are being faced by other sister agencies that are not CJC, so far we have not encountered an interruption in service, an interruption in the approval of GANs, so grant adjustments. We submitted a draw last week that was filled on Monday. And so thus far, and I can only speak through right this moment, things have continued to run smoothly. I do think, though, that in conversations with Dr. Carlson, and especially as education funding has been significantly impacted at the federal level, I think that she understands that there's a risk there. But we're willing to, if the commission approves further funding, we're going to put that through, and then we'll report back to the commission if we encountered any challenges. But so far, it has been relatively smooth sailing. Just for full transparency, the only real thing that we've noticed so far that is different with BJA with regards to some of our grants is there are a few grants that normally have posted during this time with new solicitations that we have not quite seen yet. They're not so late that it raises big alarm bells, but still there is a little bit of slowness to things. And so that would be the only thing that we've noticed so far.
That's great news. Again, I would just encourage us, for everyone's protection, to get a lot of this down in writing and maybe look at the writing through the lens of the current federal system we're looking at and just insulate everybody.
Great comments, and stole some of my thunder around one, needing a firm dollar amount and a proposal in order for us to move forward. And I appreciate Director Sanchigan's comments about how things have gone smoothly so far. I also am hopeful that remains the case, but if the past is any predictor of the future, I suspect we'll see challenges with burn grant funding. And so that leads me to my next question, which is, if you aren't able to get funding from the commission vis-a-vis our burn jag grants, what would you do? Would you be able to continue the work of the commission? Would it be curtailed? Would you have to shut it down?
Well, we have discussed this scenario. We fight really hard for our public health programs. We're trained to do that because it's often the first to get cut, is anything prevention oriented. So we've always had in mind that we would the potential for needing to go to bat for this program is there, and the relationships that we've built with the community members who have this lived experience really weighs heavy on our heart. So this is especially the program that we have where we would crank up the hustle to get it done. Now our resources are changing rapidly, and I don't know what we would do, but I think if we found ourselves in a situation of zero money, we would slow down the activities, continue nurturing the relationships, so that after the gap of funding, after we figure out a solution, then we can start up again. For me as a team leader, my goal ends up being like keeping my team intact and keeping this team funded through a rough patch. Yeah.
Great. Well, thank you. In terms of process, Ken, I'm looking to you at this point. Should we tap this for the agenda next month when we have
Right, we could table this until the 15th, and then Professor Carlson could just appear briefly remotely after
Yeah, I'd be happy to.
great,
a more formal document.
great. Commissioner McPherson?
Can I just make a quick
Yep,
comment?
yep.
I just want to thank you for your work. I think it's incredibly important. I'm very supportive of it,
Thank you.
and certainly very supportive of having people with lived experience being part of this process. I don't think you can reach solid recommendations or implementation without people with lived experience.
Yep.
And I'm particularly interested in recommendations 3 and 4. I would say on recommendation 1, I know you all discussed this greatly, but just given the line of work that I do, we see a lot of gun violence in bars. You see a lot of gun violence in marijuana dispensaries where people are robbing the marijuana dispensaries. So I'm curious about recommendation 1, given my, what we see in my line of work. And I'm curious to see, just curious to hear more about that going forward. And just want to give you that insight as well.
Yeah, thank you.
Thank you.
Great. Well, thank you for coming today,
We appreciate
present in
you.
person, and look forward to seeing you next month.
Okay, thank you for the opportunity.
All right, Will, you're up. We're going to talk about the behavioral health deflection dashboard.
Chair Solomon, members of the commission, thank you so much for the time this afternoon. What I will actually start with first, I've got 3 things that I'd like to talk to you about today. For the record, my name is William Ash Halchin. I'm the Senior Research Analyst at the Commission. I'd like to provide a brief overview of the best practices report, some of the substantive findings from that. This will be substantially similar to what you saw at the summit, but there is an opportunity if you have questions about any part of this that I can field for you. As well, I would like to show just a very brief at the end of this, a couple of slides with the data update from behavioral health deflection. And then if the commission would indulge, I'd like to change places with Carol and do a live demo of our dashboards. And if that's not the best, I also have slides for those as well.
Great.
So I am not Dr. Liz Waddell. As you may know, Dr. Liz Waddell's team at the OHSU PHU School of Public Health was contracted to do this best practices work. And as well, they are contracted to develop and maintain the statewide data system. And so this, again, is just a very brief preview of those findings for that report that will come out on April 1st, which is a little less than 2 weeks away. And so this definition that you see on the screen here, I will read to you. This comes from the Centers for Health and Justice. This is the sort of national definition of deflection, which is a collaborative intervention connecting public safety and public health systems to create community-based pathways to treatment for people who have substance use disorders, mental health disorders, or both, and who often have other service needs without their entry into the criminal justice system. I want to acknowledge, of course, that deflection in Oregon can happen before or after arrest. And so participants are not always enrolled before their entry into the criminal justice system. This is just the national definition from the national TA provider that suffuses the report. And so I wanted to provide that first. Next slide, Carol, thank you. And so there are a number of sources from the best practices report that were utilized in its development. And those include a substantive literature review, consultation with national experts, local interviews with local programs, specific reporting from grantees, as well as that statewide data system that is maintained by the same team. A lot of this is still in the early days, not just in Oregon, but also nationally. When we compare the history of something like deflection to something like treatment courts, it's just shorter. And so some of that rigorous evaluation work takes time, and it may not be yet available. And so next slide, please, Carol. Thank you. And so in terms of, there are 6 of these, and so you can stop me at any point if you have a question on one. But to start with, program coordination is really in 2 parts. There is some emerging descriptive data for this practice. However, the administrative home, as well as the role of the coordinator, are the 2 pieces here. And so there is just that emerging descriptive data on the housing of the program. There's not yet that rigorous evaluation of one versus another type of coordinating agency. However, the literature does suggest that program coordinators generally operate at sort of one of 2 ways. They may either be very high level designing and either building programs or as well building partnerships with other agencies or managing broad operational issues. And on the other side of that coin, there are some coordinators in the literature who are much more, I don't want to say hands-on, but they are making referrals, they are working with clients, they are coordinating services and treatment services for clients on a regular basis. And so taking those together, what we see is that this coordination and communication piece, particularly with other agency partners, is critical for retention of staff and the clients, as well as successful referrals into the program. Next slide, please, Carol. Thank you. And so eligibility, as we've heard so far today, that many times this substance use occurs in the context of other charges, and these can run the gamut, but generally tend to be lower level quality of life crimes. And so for those localities that are ready to scale up, these are two strategies that can be employed by that local program to scale up. And that could be including or allowing other low level, like quality of life crimes or prior convictions after a certain period of time for otherwise disqualifying events. And then as well at the outset, writing rules that are deliberately flexible so that the team can come together and make case-by-case decisions.
So, Will, if I may, are these recommendations that you're making to the counties as you're communicating with them about their programs?
So this is more of a preview of the report that will come out on April
yeah.
1st.
Okay.
And so that work, I don't believe is happening.
Mhm.
I think some of this sort of comes through the TA work that OHSU is also doing, but sort of these recommendations on this screen, not yet, sir. No.
Got it. Thank you.
Thank you, Carol. This is a brief overview of the deflection pathways model from the Centers for Health and Justice. Again, this is a national model that has been used largely. Oregon is using that officer intervention model, which is the next to last one from the bottom. And then an emerging best practice related to these pathways is that when the capacity, when the resources, when the staffing permits to operate more than one. Next slide, please, Carol. Thank you. So in terms of first point of contact, again, we have some emerging literature, but it suggests that is descriptively that most of these do involve law enforcement. And we also see that in Oregon from the statewide data system. But that co-response can really facilitate warm handoffs to services in the field. And that co-response, of course, can look like many things, but it's most often when a law enforcement officer is in the field and then someone, potentially a peer, for example, comes out to the field as well. But, excuse me, the thing to remember here, or what the report is illustrating, is that it's not always who is doing that first point of contact. It's about how that interaction goes. It's about the quality of that interaction. And so it doesn't have to involve law enforcement, and it doesn't have to involve treatment folks. It's about how it goes more than who it is. And so next slide, Carol. Thank you. This dovetails nicely into this discussion of warm handoffs. That is, of course, when law enforcement or other first responders, police, fire, EMT, mobile crisis, and others connect individuals to services in person or to program staff in person. And then of these best practices that I've been presenting to you today, this one is probably, if not it's one of the strongest links in the academic, sort of national literature, that this warm handoff is the best strategy. Of course, that can look like a lot of different things. The peer support specialist example that I gave previously, as well, direct transport to a drop-off center, or even mobile crisis, encountering someone and then connecting them to the program. However, this is not possible at all times. It's not possible in all places. It's predicated on the resources and capacity of a local jurisdiction, as well as their specific priorities and needs. And so it's not always available. If it is not available, if this best option, which would be this warm handoff, is not available, then reaching out to the potential participant as close to the time of that deflection referral as possible would be the very next best option after that. Next slide, please, Carol. Give it just a second.
Technical challenges.
Commissioners, I have notes. I can already start
Go-
talking about. Oh, yeah.
Oh, Commissioner McPherson.
Thank you. Since we have a technical pause, I just want to make a quick comment about how important it is, and from my perspective, to increase eligibility for deflection programs. Oregon Justice Department testified and presented slides last month that we're in Washington County, so I'll use Washington County first. Public defense related case filings in Washington County in fiscal year 2025 went up 34%. And the analysis and projection for fiscal year 2025 to 27 in the state of Oregon is 22% increase in public defense related case filings. We have an unrepresented crisis. In Washington County, the providers are about 100% or a little over 100%, all the providers of their capacity. So I don't know who's going to represent all these individuals for all these increased case filings, and deflection, particularly for misdemeanors and quite frankly, some low-level felonies, is the best thing that we can do to try to help our system. So I just want to say thank you for your work and just explain why I think expanding deflection is so critically important. Thank you.
And we actually had a little bit of a conversation about that with folks in Washington County today. But I agree, ultimately, we know that only a small portion of people arrested are arrested solely for PCS, and expansion of eligibility criteria will increase the eligibility and referrals statewide. So I'm glad to see that as one of the recommendations. Yeah, go ahead, Vice Chair Bovet.
I'll just add, because we talked about this in work session, and I actually agree with Commissioner McPherson. But this assumes, I think, that we not only use evidence-based practices, which I think is what you're pointing out and where we're headed, for a new system with some mixed studies so far, but it's very fresh. But it also assumes or presumes that we will have adequate funding to support the deflection programs and the expansion of them. And unfortunately, as we spoke earlier in work session, the trend line at the state of Oregon, in particular by the OAC, is just the opposite of that. So it's hard to envision an expansion when those that are making funding decisions and policy decisions outside of this commission don't seem to be supporting the expansion of the programs. Don't mean to throw a wet rag on it, Commissioner McPherson, because I agree with you 100%, but we got to have the systems of care in each of the 36 counties necessary to support an expansion when it seems like we're in a contraction mode.
And I agree. I do think it becomes a chicken and egg question though as well, because I hear this quite a bit. We have to charge people because we don't have community-based resources to help them. But if you don't prioritize community-based resources and prioritize deflection, then you'll always be in the situation where you just charge everybody. And that just is not good. It's not good for short-term public safety, long-term public safety, and it's not going to work either. So I understand. Thank you.
Well, keep us moving because we are on a little bit of a
Absolutely.
time crunch. Thanks.
So defining success, of course, I'm talking about more than a 0 for no and a 1 for yes and a binary system. I'm talking about within the local programs, what is it that determines that success? And the short answer nationally is that there is no standardized definition of success. There are no specific metrics or outcomes that can be measured in every case. There are some that have some promising practices. There are some that have been evaluated locally, but sort of a very rigorous evaluation of success outcomes has not been found yet. But there are generally two ways in the literature that success is measured. On one side, you have determinations by program staff that can be related to many things. It can be about higher levels of functioning or functional status, lower levels of substance use or recidivism, finding housing or employment, some of those social determinants of health. And then the important point there is that the program staff make that determination. It could be the treatment staff or a team But that is different than measuring success as with discrete metrics. For example, receiving an assessment, following the recommendations in that assessment for 120 days, and in the last 30 days, you must have non-positive urinalysis screens. So those are all more discrete items, and then deflection is complete when those things are done. So both examples exist in the literature without as much rigorous evaluation of which is better just yet. In Oregon, of course, there is that massive variation in program goals, their capacity, and their geographic setting and their model designs, but all of those local programs are reporting into the statewide data system using specific metrics, and so we will be able to do some direct comparison as a result of that. And so, next slide, Carol. This is just one more opportunity for questions about the best practices report before I transition to a little bit of data.
How is it going to be disseminated?
We do have a dissemination plan, at least at the start. It is technically a legislative report, so we will first put it on our website and as well submit it to the legislature. I think we'll put it on the actual BHD CJC webpage so that when you click on it, you'll be able to, any interested party could click on it and access it as a resource. And then there may be some other additional avenues that we could pursue.
Is there any reason why we couldn't send it out to all of the participating counties?
I don't see that there's any reason we could not do that. That's possible, sir. Yes.
Great. All right. Any other questions?
Okay, I have put that aside. I have just two data slides before I move over to Carol's seat to show you some dashboards. But I do just want to illustrate that first, this map, as we can see, there are a number of counties who have a lot of referrals, and then there are some counties who don't have as many. Not every county started on the same day. Some are very new in their programs, and some would have lower populations as expected because of other factors. So just wanted to point out that the work is happening, and as you can see, those in some cases along the I-5 corridor, there are many referrals into the statewide data system, and this was correct as of the 3rd of March. Please. And this last one, I'm not sure if the color is better. Oh yes, it's better on the monitors. Again, all the counties are reporting their deflection data to the REDCap statewide data system that is maintained by OHSU PSU School of Public Health, and they are expected to report monthly. Again, programs have different start dates, but what we can see here is that there have been just under 900, about 894 referrals for about 841 people. There are some duplicates, as you see listed on the bottom left side of that screen. But as we move through the system, we can see that of those, about 882 deflection events have been created. And then of those, about just under 700 were eligible for deflection, and 560 of those folks did enroll. And then the completed deflection, which is very pale on the screen, is about 45 people. There have been about 119 who did not complete deflection. And then there are about 396 that are still in the program. I do want to point out that in many cases, programs require 120, 180 days of program participation. And so it's just not possible for a lot of folks to have graduated at this point. It is, unfortunately, it's a lot easier to perhaps not engage in treatment and fail from a program or be unsuccessful than it is to go through the time.
Great. Will, I've got a question, and so does Commissioner Freeman. My question is, do you have any insights into the drop-off between the 700 people that are eligible for deflection and the 560 that are enrolled? Are we seeing any common themes there as to why people aren't getting enrolled despite their being eligible?
Chair Solomon, that is not something that I've investigated yet, but it is something that I will look into and see if we can have an answer.
Okay, great. Commissioner Freeman?
Thank you, Chair Solomon. That was the third question I had. So my first question is, you got your total number of referrals, then the number of deflection events. I'm curious what the difference of that is. And then if your referral or deflection event is sort of, asking people to go to deflection, is the gap between that 8.2 and the eligible for deflection, is that the number of folks that simply don't show up? Or do we know how many people are actually going, after they're, referred for deflection or whatever you want to call that? How do we know they go to wherever they're supposed to go to try to start into the program?
So, go ahead, Will.
Commissioner Freeman, just to answer the first part of your question to start with, the difference between that first bar, that 894 down to the 882 deflection events, there are some duplicates. Some counties allow that. Some counties will allow a person to go through more than one time. And then
Okay.
there are some cases with multiple, where an individual is in multiple counties. And then for the second part of your question, the difference between the 882 events and those that were eligible for deflection and enrolled, just for the first piece of that, there are a number of reasons why someone could not be eligible. It could be a result of a previous conviction. It could be they're not a resident of a county, for example. And so we do track the reasons why folks are not eligible for programs. And so that is something that we can, of course, present on as well. And then it is voluntary. There is a choice, and there are some folks who, this is all anecdotal and qualitative evidence. This is not something that I've printed from statistics, but there are some people who don't want to do that, right? There are some people who just say, I'd rather do the conditional discharge. And so some of that is choice and voluntary. I have not looked deeply into the difference between those that were eligible and those that enrolled, aside from those who chose not to enroll as of yet, sir.
And having looked at yes, go ahead.
So just real quick, thank you. That's a good answer. There's a handful of counties that chose not to do this program. And one of the concerns that we're hearing is that, the concept of, if you don't take them to the place and they're not required to be there, that they may not take advantage of the opportunity of deflection. So that's the question I'm asking. Where do you capture, that drop off, or that I really don't want to do it? You talked about other than law enforcement, so some other organization is out there trying to help with deflection, and for whatever reason, the person that needs the help doesn't get to where they need to go. So that's the number I'm trying to look at and be able to answer that specific question when I'm asked, well, these people aren't accounted for. How do you know it's working?
Yes, sir. So we do capture information at the deflection event level about the pathway that the person came in with and how they entered the program. And so we would be able to compare, for example, a warm handoff versus a citation was issued. I don't know that we have the answer that you may be looking for just yet, Commissioner Freeman, but I'm glad to look into that further.
Director Sanchagrin.
Yeah, just to build upon what Will was mentioning, I think that one of the points, so the way the legislature set up our reporting initially for this program is what we're talking about today is the best practices report. But then 6 months after the filing of this report, we're required to, with a data lens, examine the best practices that we've been talking about. And so I think Commissioner Freeman raised probably one of the key issues that a lot of counties are wrestling with right now, which is that warm, immediate handoff. And so what we can then do is, knowing the status of our programs at the time of the evaluation for this next evaluation, if we have a county that has a larger gap between who is eligible and who is enrolled, but they lack warm handoffs, we are able to bucket the counties in ways that it's still very early. I do worry that the legislative schedule is a bit aggressive as far as doing a county by county breakdown and program by program breakdown because they're evolving so quickly, but that would be the aim. And that's something we could continue to do as we go forward, to be able to then give feedback to counties and say, relative to your peers, you have a relatively low referral to then eligibility to then enrollment rate. And this is what you have compared to counties that have a higher rate. And so our hope is to be able to do that when we file that report close to the beginning of fall.
And I think that makes a lot of sense to the extent that we're able to make some comments or determinations based on the data. I think what we're seeing, at least, is for the people that are still in the program, and each county has a different definition of what meaningful engagement looks like, but therein lies kind of that nexus is, okay, at least we know based on the 560 people that are enrolled that the counties have said approximately 400 of them are still meaningfully engaged in receiving services. And I think that's, when you look at the population that we're serving here, that to me seems like a pretty good number that we have, what is that? 75% of people still engaged that were originally enrolled, where we don't have a big stick. Right? If they, walk away, they're not facing serious time, that this has to be more of an incentive-based program for people to want to receive services. So that gives me hope. And I also agree that the more definition we can put around this and continuity in the metrics that we're using to evaluate each county, the easier it'll be for us to get good data.
Thank you, Commissioner. I believe this is the last slide. Yes, and so with your indulgence, I will transition over to the side computer to give you a very brief live demo of our two deflection dashboards. Great. PCS and deflection dashboard. Everyone can still hear me. Okay, sure. Yes, I can hear myself now. Okay, so I always start this at the CJC website just because I feel it may be the easiest to navigate. And so at the very top left of the screen here, I'm hoping that you'll have monitors as well. You can click on dashboards and that will take you to this blue hyperlink here that I'm clicking. And it will open our dashboards. This is how you can access all of them. Today, we're just going to briefly look at the behavioral health deflection dashboard, which I'll open in a new tab, as well as the possession of a controlled substance dashboard. Loading. You're having that same. Oh, it's showing for you. Okay, perfect. I'll say, okay, so commissioners, across the top here, what you'll notice is that there are several different tabs. I won't click on every single one of them for you. I do want to navigate to the About tab, which has some important information. There it is. Some important information. We are on the Behavioral Health Deflections Programs dashboard. It has important information about House Bill 4002, as well as the grant program and some helpful definitions. But there are two things here that I really want to draw your attention to, and that is the reminder of the program map, which is available. It is the basis for the maps that you've seen in presentations. And of course, if you hover or click on any particular county, I sometimes pick on Deschutes because they're in the middle of the map. You will actually get a small box on the side that populates important details about that program, including who to contact, the coordinating agency, and total formula funding, as well a list of those required program partners is available here. If, for example, there are more than might normally fit in a box, you can always hover your mouse over that box to see the full contents of anything there. We keep this updated as well as we navigate to the budget details, which is a detail that a lot of people really like to use on this dashboard. This gives us a statewide look at where the money is going and what it's being used for. And then as we get adjustment requests for particular programs, we do come back and update this. And so just to remind everyone of how this works, if we were to click on one of these bars, I clicked on the treatment bar, what we can see is that from every single application from each county, you can see where that money is going. And if you hover over, it provides the actual line item description. So for example, if we wanted to look at Deschutes for Narcan, we can see that this is part of treatment that's been categorized as treatment for the sheriff's office, and it's of course medication to prevent overdoses. This view is available not just statewide, but it is also available for any particular county if you want to focus in on one county versus another. So
We should probably wrap up here. Is there any final comments? And I guess one question that I have is I thought we had a link on here to the PCS arrest day.
yes, I believe that sorry, I have a thing over here. We have it the other way for now. So from the
Oh.
PCS, you can get to programs. We'll of course link it
Can
back
we
the other way.
Yeah,
Yes,
that
sir,
would be
of
great.
course.
Thank you. Any other comments, questions? Thank you very much, Will, for all of this information about the dashboard and the report. Very exciting. All right. We will move right into agency update, and then we have special announcement to make.
Yep. So a couple brief agency updates. I toyed with what order to do these in, but I actually think that, especially in interest of time, I'll start with the announcement, and that is just that I, as an agency director, want to really acknowledge the work that Vice Chair Bovet has done for the commission, and the staff feels the same way. I've only been at the commission for a relatively short period of time. In the grand scheme of things. But Rob has been here the whole time with me. And in fact, Rob, I think, has only not been a commissioner for the whole time for only one person who happens to be in this room, Kelly Officer. Every other staff person has never known a commission without Vice Chair Bovet. And I know for me as a director, and then especially as a new director during COVID, there were a lot of times where the guidance, advice, and just support that Vice Chair Bovet provided to me were invaluable. He has been vice chair also as long as I've been around, and especially as we went through some difficult times as we transitioned from Chair Brooks and he was acting chair. He and I were on the phone weekly, if not more often. And so I know that for me, I'm really going to miss having Vice Chair Bovet around. I'm going to miss his contributions when we do our sentencing changes. We're all going to miss the history that he knows and brings to all of this work. And so I wanted to make sure to have this opportunity to say a few words. And we also, of course, got him a nice plaque that hopefully, like on your wall of guitars and everything else, you can find a little bit of room for, and I can hand that through our wonderful chair here, a little bit of room for some recognition for the decade of service that you've provided on this commission. And so I'm not sure if other commissioners have any thoughts, but I know that I will miss having Rob around as a commissioner, though I know he's only a phone call away.
Yeah, I also would like to chime in and say during my 10 years chair, Rob has been more than a vice chair in name, and someone that I could regularly count on to provide historical content, legislative knowledge that is deep, and the ability to think about all things CJC in a very comprehensive way. I mean, not only do you provide motion language, I don't know what's going to happen with our motions when you leave, but I'm sure we'll muddle our way through it. But I think that's the least of your many contributions to this commission. So it's with deep gratitude that I have for all of your contributions over the years, both on the commissions and on the commission and on the sidelines. Doing this work, that we get to honor and appreciate you.
Guess I should say something. First, it's been my honor and privilege to have worked with the commission and commission staff for the last 3 decades. and to have served on it for the last decade. I was just mentioning this to Ken the other day because I've gotten to the point in my career where I've just entered the twilight of my career. And, it's that you become reflective. And I reflect back on it all. And the stuff that I've worked on that I think is the most meaningful is my work here with the commission and then on the commission, creating and funding diversionary programs, starting from drug courts back in the 90s to justice reinvestment and now diversion and many other ones. And I'm not far. I'm accessible to anybody who, if you need the history, I can certainly talk about it. But really, what's been most meaningful in the past 10 years has been kind of what Ken described. Really working closely and collaboratively with other commissioners, this commission, but also previous commissions, and the staff of the CJC has just been rock stars for decades now. And, this is why, as I mentioned in the work session, this is why Ken gets dragged sometimes involuntarily in front of legislative committees, because whether you all realize it or not, this commission and its staff are generally recognized in a bicameral, bipartisan fashion as highly effective. And we are. I think this commission can take a lot of credit for doing a lot of the work that Carl mentioned earlier, diverting people out of the system that don't need to be in it, because what they need is help with addiction or behavioral health. And I'm just proud to be a little sliver of that and to work with all of you. And I look forward to your great work in the future. So thank you.
So that is my segue into a couple of announcements as well related to changes on the commission. We have 2 new commissioners who are slated for Senate, hopefully Senate confirmation, but at least Senate consideration starting next month. And so on April 14th, the Senate Committee on Rules will meet, and the 2 folks that we will be putting forth before the committee. First, a replacement for Jeff Auxier, who is now the Honorable Jeff Auxier. And that will be DA Christopher Perosa from down in Lane County, who, while he's relatively new to his position, he's been with Lane County, I think, for 20, 30 years himself. And so I think that that'll be an amazing perspective to add back to our commission. The second, who will be technically in Rob's vacating seat, will be Holly Harris, who many of us know from as staff. So Holly is the current Deputy Director of the Deschutes County Behavioral Health Division, and especially with the expansion of the commission into work that really squares on behavioral health, we think that that is a perspective that has been missing, certainly amongst our tight-knit group here. In addition to that, we will not have a vice chair anymore. And so I think that, of course, it's up to the chair as to when we should take care of this business, but we will need to work on nominating a new vice chair. And then also we can round out our executive committee again, just as a reminder for commissioners. We have statutorily the ability to have an executive committee of 3. That's the vice chair, the chair, and then 1 member at large who could, it's not something we've done hardly, maybe once, I think, in the time I've been at the commission, but take action for the commission in between the formal meetings that we have. And so I'll be working with Chair Solomon on that. The last bits of information I want to provide is a legislative update. We are coming toward the first work session posting deadline, which means that a lot of things that have not begun their journey through the legislature will not, which is always nice for staff doing tracking, but there is still a lot going on related to CJC. I think as has been mentioned, our public hearing for our budget bill will be April 3rd. Our first attempt got snowed out at the legislature. We do have 2 agency bills that are progressing through the process. The first is our sentencing rules changes bill that we're required to file every long session. That's HB 2933. That passed the House chamber and is pending referral to Senate Judiciary. We also have a bill that proposed to study the impacts of SB 48 and pretrial changes across the state. That also has made it through the House chamber and is just awaiting Senate judiciary hearings. We do have a number of other bills that would ask CJC to do things that we are currently monitoring. The first is HB 2233, which would renew our pass-through funding for the Oregon Justice Resource Center's work in Coffee Creek, working on legal issues for the female AICs there. We also have SB 938, which would provide some small changes to our restorative justice grant program, mainly focused on who can be funded through that program. SB 960 would provide an additional $10 million of funding for our organized retail theft grant. That is another one we're following. And then up for a hearing in Senate Judiciary today is SB 1120, which most folks are referring to as the GIPA bill. So this is the bill that would try to make changes within Coffee Creek following some reporting and then also some media reporting and then also legislative reporting in that area. And in that one, it's something we discovered relatively recently, but CJC would be required to study and to make recommendations on staffing ratios relative to the numbers of AICs within the institutions to maximize safety for folks who are in the institutions. We're curious to see where that one goes. As I mentioned, that's relatively new. The two other things that we're working on that have not really dropped yet that will be in, I believe should be in the Joint Committee on Addiction is some changes to our grant programs, really some ideas for changes to our grant programs. The first would be deflection changes. I don't have too much detail on that yet, though I'm helping Representative Kropp from a technical standpoint to let him know what CJC needs to continue to administer that grant program effectively. The other one is also something I'm working closely with Rep. Kropp on from a technical perspective. He likes to refer to it as quote unquote JRI modernization, though I think that's not really the way to talk about it. What he is looking at doing is, the question he asked me essentially was, Ken, how might you change your grant programs if instead of them being built up over a decade in kind of a piecemeal fashion, they were all built at once? And so we began to talk about ways to increase efficiency within the grant programs and to streamline the approval process, the application process. And so for the most part, the changes that he was looking at making would be trying to come up with a process where counties would only have to apply to the CJC maybe once or twice, as opposed to upwards of 10 times. And so the framework that we've developed and we're trying to work on statutory language to kind of enact would be if you could envision making an application to the CJC and going on, and you would have a checkbox and you'd be able to say as a county LPSC, I want to do JRI, I want to do deflection, I want to do impacts, I want to do specialty courts. You would be able to opt in essentially to those funding streams. Yes, it would lead to some questions that you'd have to answer about each program, but still it would be a one-stop place that would also help us to have a better view as to what a county's comprehensive criminal justice plan essentially is. And so that would be combined with some, like I said, streamlining of the grant process. That is also where we've tried to put in language that would convert our grants into a little bit more flexibility from a funding standpoint to really help with our grantees so they don't lurch from biennium to biennium. So I'll have many more updates on that. I honestly am not sure how far or what type of legs that bill might have, but hopefully when we reconvene in April, we'll have some updates there. And so I'd be happy to take any questions, but even though we're getting towards the deadline, it's still very, very busy for us legislatively here at CJC.
Great. Questions for Director Sanchagrin?
Not amazing.
Wow. I mean, 159, we got through a very tight agenda. Given that this is Vice Chair Bovette's last meeting, I think it only appropriate that I hand him the gavel and you officially adjourn the meeting for us.
Meeting adjourned.
All right. Thank you.
Yes. Oh, yeah.